My name is Allan Josephson, and I'm a child and adolescent psychiatrist. That's a physician that practices the treatment and diagnosis of mental disorders in children and adolescents. Gender dysphoria was not much of an issue when I first started my career. It was virtually non-existent. And it's only been in recent years that this has become prominent in our clinics and in our culture. But what's happened the last 5 to 10 years, the astronomical increase in the numbers being reported, the numbers coming to clinics, is just stunning. This phenomenon of the increase in transgender children and youth has to be a psychosocial, culturally mediated phenomenon. It cannot be due to biology because biological mechanisms don't change that quickly. There's a lot of misinformation that leads to the discussion of science of gender identity, and this is a real problem. There are statements being made now by many clinicians that we determine male and female not by genetics or by physical observations or by hormones, but by gender. So we've replaced the facts of existence, biological existence, with a feeling. I feel like I'm male or female. The dogma being pushed, not by science, but by activists, is that this is being driven because of bias, stigma, and if children were just treated fairly, they would not be suicidal. The real fact is probably more something like this, that there are a complex number of things leading to disturbed feelings that children have, confused feelings, lack of direction, insecurities of one kind or another. And these feelings give rise to the transgender phenomenon. And it's these feelings that are really related to the suicidal behavior. The major problem with the science at this point is how patients are selected. The study groups are often selected from camps for transgender children. In other words, a group of patients that are predisposed to want to become transgender. The raters of various behavioral scales often are those with biases. This includes those running the studies as well as parents. Major violations in protocols of academic excellence, and that would not occur in any other form of work. There's also something that's very concerning in that some of the guidelines that professional organizations have, two recent guidelines that the American Academy of Pediatrics proposed have been influenced by activist groups. This would be unheard of in any other area. These are non-physician individuals who are on the study panels that are writing the guidelines for treatment of these patients. So the inherent bias in many of the people doing this work is more of an activist nature rather than scientific nature.